Hi everyone, my name is Sydney Martinez and I'm an epidemiologist at the University of Oklahoma Health Sciences Center. I'm also the mom of a child with malrotation, and I've been in collaboration with the Intestinal Malrotation Foundation to develop a patient-generated research registry for the malrotation community. The Intestinal Malrotation Patient Outcomes and Wellness Registry, or IMPOWER, is that registry. So it's designed to capture information on the symptoms, diagnosis, treatment, and follow-up among patients with malrotation. For more information on the Intestinal Malrotation Registry, you can look on the Intestinal Malrotation Foundation's website. The main flyer is located on the website and provides information on who's eligible. If you're interested in starting the registration process, you can click on the red cap link in the middle of the flyer. This will take you to a red cap form. First, you'll have to prove that you're not a robot. So click I'm not a robot. It may or may not provide instructions on selecting images. So in this case, as an example, it asks to click on all pictures with chimneys. So that's the verification process that you're not a robot. And then you just click on Begin Survey. This opens the registry overview and screening form. It provides a little bit more information on who's eligible to participate. You can participate in the registry if you've been told by a clinician that you have malrotation, so adults with malrotation can go ahead and enroll. Or if you're a parent and your child has been diagnosed with intestinal malrotation. For a parent to enter a child, the child has to currently be 17 years of age or younger. Parents who have lost a child to malrotation can also enroll their child in the registry. Right now, we're only approved for patients who currently live in the United States, and you also have to have a working email address. You'll be asked to register with your contact information and complete a series of initial surveys to give us a lot of your health information and tell your story about symptoms, diagnosis, treatment, and outcomes. Then we will give us permission to contact you every 6 months in order to do follow-up surveys. And we also would like those who are interested in being a part of being contacted for future research studies to sign up. So on this initial screening form, go ahead and fill in the information based on your current situation. And you have to include a valid email address. I suggest that you use your primary email address that you check most often. Otherwise, if you use sort of a spam email address, then you will be less likely to check the 6-month update. So I would use a primary email address if at all possible. And then click Submit. Based on your responses, if you're eligible to participate in the registry, you'll receive an email. This email should be received within a few minutes. I would check your spam folder. Sometimes it goes into your spam folder, but if you don't receive an email within about 30 minutes, then I would go ahead and send me an email at sydney-martinez@ouhsc.edu, and that email is on the flyer because something might have happened, because you should receive it pretty quickly. This will send you a unique link that's specific to you based on your screening question results. The initial registration process will take probably up to about 30 minutes. It's a pretty lengthy and comprehensive survey, so please allow adequate time, and we suggest completing the registration on a laptop or a desktop computer or a larger tablet. You can use it on a smartphone, but if a larger device will give you more flexibility with typing in responses and seeing the full survey. So when you check your email, you'll have an email from IMPOWER Registry that says welcome to the IMPOWER Registry. Your unique link is right here. It's called IMPOWER Registration. So click on the registration form, and this will provide a lot more detailed information about the registration process and the registry overall. This is a national patient-generated registry, and then it also provides my contact information. Before registering, you have to again, indicate whether you're the parent of a child or the adult with malrotation. If you're the parent, you'll need to give us a little bit more information on the age or status of your child. So if your child is currently 6 years or younger, you don't need their permission to enter them into the registry. But if your child is between the ages of 7 and 12, you will need to talk to your child about the registry and get their verbal permission to join the registry. But we won't need their signature if they're between 7 and 12. If they're between the ages of 13 and 17, then we ask that you register with your child so that your child can also provide an electronic signature. And then if you're a parent who has lost a child to malrotation, you're also able to enroll your child in the registry. If you don't select a field that's required, it'll show you a little warning saying that your response is required. Depending on the level of, what status of your child and the age, this might look a little bit different, or if you're an adult. But this will be the consent form. It'll provide some key information about the research study, followed by some detailed information about the study, and then we need to get your consent. So if you're a parent consenting to enroll your child, then this will be information about you. Whereas if you're an adult, this will be your name and your information, if you're the adult with malrotation. So we'll go ahead and put in some information here. Oops. We do need your electronic signature for you to participate, so you'll have to click on Add Signature, and then you do your best to provide your signature. Then you click on Next Page. This provides a PDF version of your consent form with your information that you provided to us and your signature. So you need to certify that this is correct. This will also email you a PDF of a copy of your consent form. Next is a HIPAA authorization form that describes how your protected health information will be used and shared as part of the registry. We will be collecting your name and contact information just so that we can maintain contact with you for future updates. However, we will not be using names or any protected health information in any reports or anything like that. So provide the date of HIPAA authorization, and then again add your signature, and then select Next Page. And then here you will again certify. Once you've completed the initial consent process and given us permission for you to join the registry or for you to enroll your child in the registry, you will then be taken to a patient demographics form. This will be followed by a series of forms where we're asking information about the patient with malrotation. So if you're an adult with malrotation, then you're entering information from this point forward about you. But if you're a parent with a child who has malrotation, then this point forward you're entering information about that child. There are different types of questions in the survey. There's some fill in the blanks where you just type your answers. There are some date fields where you can choose the date on the calendar. There are some radio buttons. The circles mean there's only one choice. You can only choose one response. And then there are some drop-down menu items where you can find your particular state, for example. And then there are checkbox squares that allow you to choose more than one, so you can check all that apply. You can save at any point you can save and return later. This, because it's a unique survey just for you, it will give you a unique code that you need to you will need to re-enter to be able to start from where you left off. So make sure you write down the code that it provides to you and remember that code. Otherwise, you'll have to start from the beginning. And that's about it. Again, the survey will take you probably about 20 to 30 minutes because it is pretty lengthy. But we hope that you will take the time to tell us your full story about your malrotation journey. And we also hope to provide the malrotation community with data in a timely manner. We appreciate your interest in the registry, and if you have any questions, please feel free to reach out to me at sydney-martinez@ouhsc.edu. That's listed on the registry, and then also you can contact Intestinal Malrotation Foundation as well.